What's up, everybody? It's your girl Amber, and I hope that you guys have all been doing well during this pandemic. I know that it's hard times for all of us in so many different ways, especially mentally and emotionally. Thank you to all the workers that are putting their lives on the line to help others. Now, with a lot of misinformation going around, I am very happy that I get to do this interview right now. So I get to have a conversation with Dr. Georges C. Benjamin, who is the Executive Director of the American Public Health Association. And he was one of the first doctors to ring the alarm at the higher death rates that were affecting the African American community. So let's start the interview. So I know that there's a lot of information out there, but what are the symptoms of COVID-19 and what is the procedure if someone thinks that they have it?
So sore throat, muscle aches, sometimes a small early cough, just like the cold. It looks pretty much like a common cold, unfortunately. If you think you have symptoms of it, we're telling people to call your doctor if you have one, and talk with them about your symptoms. Also, you want to think about whether or not you've been exposed to someone who had it. That would be also an important part of the history that they would want to know. And then they will direct you as whether or not they need you to get a test or not. But by the way, a lot of people are, if they think you have symptoms and you're not really sick, since we really don't have any other treatment except supportive care, in most cases you're told, look, go home, rest, get your temperature down, drink lots of fluids. Usually kind of stuff you take with any kind of viral illness.
Is it true that if someone has COVID-19 and they're severe versus if they're mild and you get exposed to it, does that determine how bad it will affect you?
Not necessarily. So what we do know is that people are most infectious in the first few days, right before they start having symptoms, like 2 or 3 days, and then the early part of the illness. And like a lot of these viral illnesses, most people are sick for somewhere around 7 to 10 days.
It's a different range for every single person. It's very different.
Absolutely. It depends on how much, they call it viral loads. Basically how much virus you get exposed to, how good your underlying immune system is. So the older you are, as you know, your immune system, fades a bit. If you have some underlying immune compromise, so if you're on cancer chemotherapy or high dose steroids or some medications that reduce your immune system.
Can you just debunk some of these myths? Because right when this first happened, the African American community thought we were immune.
Well, let me start right now by saying we are not immune. Anybody who thinks we're immune, is living on Mars. We are not immune. And in fact, for many of us, we get disproportionately sick should we get the infection. In addition to that, wearing a mask, wearing gloves, washing up our hands frequently.
How is the COVID-19 pandemic affecting the African American community, and how is the experience different?
Our experience with this virus, unfortunately, shows that we're disproportionately getting sicker and much more sicker than others. And a lot of that has to do with chronic diseases that we have, and we often get younger than others. High blood pressure, heart disease, diabetes, for example. And we have a lot of public-facing jobs. I work in an office. My colleagues and friends who are bus drivers, who work in a grocery store, they're much more likely to be out in the public, even while we're all locked in right now. And that puts them at greater risk.
So is there anything that people can do while having those jobs that put them at greater risk, as well as living in their communities where a lot of them are living on top of each other, very close quarters? Is there something that they can do?
If you work in a grocery store, I'm hoping that your manager allows you to have periodic times to take off those gloves, which they should let you wear, and frequently wash your hands. In addition, a lot of us put shields, like the grocery stores I've gone into and the pharmacists now have a kind of a glass shield in front of us. To the extent we can avoid having to hand things back and forth to people. That's important. For those of us who live in homes in which there's a large number of people, got a couple families living in, a lot of kids, etc. It's tough to physically distance. Do as much as you can. That means that certainly if someone gets sick in your home, that you need to figure out how you take care of them. That means having masks and gloves to take care of them, washing your hands frequently. If you have symptoms at all, it is better to go to the healthcare system early. Calling your doctor, don't just show up, and letting them tell you what to do versus just assuming, I'll get over this. Because far too many of us wait till it's too late to get advice. We need to protect each other. So that means going out and wearing the mask yourself, staying physically distant from other people. Don't just, don't go out playing basketball right now. We got time to play the hoops later. Now's not the time to do that. Wearing a mask. Now, masking while black is a problem, right? We know that far too many, particularly African-American men, are being challenged while they are
wearing masks. And that's what I was going to ask next.
Yeah.
well, don't wear a mask in the bank. Carry it in your hand. Put it on your forehead. Put it in when you're about to interact with the person. Tell them, I'm putting my mask on so I can interact with you. And unfortunately, we just have to do that kind of stuff.
In California, they're asking everyone to wear masks. In other states, they're saying that if you have symptoms, please wear masks to protect others against yourself. Because of that different information in different areas, people are getting treated. I just saw an African-American man being pulled off of a bus for not wearing a mask. And most of them were wearing masks, so then it was just hard to understand why he was such a danger in a state that hasn't made it a priority to wear masks.
It shouldn't be like that, but I don't want anybody shot or arrested because, they were profiled. And we are going to get profiled. And that's just a challenge of life right now.
I've done my research, but could you please shed some light on this virus being airborne?
Yeah, and the tragedy of being in public health as long as I have is that I've said things in the morning that I've had to regret saying in the afternoon. Initially, we thought this virus was simply the kind of virus you get by someone coughing and sneezing on you. There is some studies that suggest very clearly that it can be aerosolized, meaning that these are very, very small particles that kind of float in the air. Now, when you're outside, it isn't such a big deal. But if you're in a closed space and someone coughs or sneezes, it is possible to get this probably from across the room. There is some evidence that that's the case. So one of the reasons is we went from early telling people not to wear a mask because we didn't think, you needed to, unless you were in a healthcare environment. To now telling everybody to wear the mask is because we've learning new studies that suggest very clearly it's small enough particles that it can float around the room. And if the fan is blowing or the air conditioner is blowing, if you're downwind from it, you can get it. And again, it depends on how much of it gets in your system and how strong your immune system is in terms of whether you get sick or not. And then about 80% of us, 8 out of 10 people, it's not such a big deal. It's kind of like a bad cold. But for that other 2 people, other 20%, we can get really sick and some of us are going to die.
We've been quarantined for, I think, 30 plus days now. I heard that after 2 weeks of being quarantined, it's safe to say if you haven't shown any symptoms, you might have not caught the disease. At that point, if you've been quarantined and you haven't seen any people, is it safe to just see close family?
Well, let's be careful with the situation. So obviously, if you don't show any symptoms after a couple weeks, you probably don't have the disease. Understanding there are some people who are asymptomatic, don't have any symptoms. That's what that means. Who can infect others. They feel healthy, but they can infect others. And some of them come down later and get sick. If all of you have been in that situation, it's probably okay to get together, but not in large groups. I would not still encourage. This is not time to have a birthday party. This is not time to have a barbecue. And I think that we're going to be still closer together in small groups for probably about another several weeks. I think that once, as a society, we're seeing less people hospitalized, less people die, and those numbers are going down for 2 weeks for the whole community, then we can begin to go outside. But understand there's still pockets of infection out there. So it's not like 2 weeks from now, we can all start going out and going to the beach and getting together and having a barbecue. Not gonna happen. We're gonna have to slowly open up society. And that 2 week figure is just to say that you're not sick. That doesn't mean that the other person down the street or your family member isn't sick.
How long do you think the quarantine will last, and what will real life look like as we start to be able to go outside and things open back up?
Well, depending on where you are in the country.
In New York.
Probably in LA, once they hit their peak. So New York is going through the downside of this right now. So hopefully if this continues in New York for a couple more weeks, then the folks in New York will begin to slowly return to normal, meaning that if you're a vulnerable person, you got one of these chronic diseases, you're probably going to need to stay inside. If you're young and healthy and don't have any other problems, then you probably can go back to work, but you're probably going to be working at a distance from one another. Maybe staggered shifts, maybe driving in and out. Continue not to take public transportation if you can avoid it. So when you're on public transportation, you're still going to have to physically distance. So the answer is nobody knows for sure. But over this summer, we're going to slowly get back to something near normal. That assumes it doesn't come back. Yeah, we're on the downside of this because all the sick people went in the hospital and all the rest of us are at home.
Right.
But some of us who carry the virus who are at home, when we go back out, it's going to come back. We don't know whether this is going to come back or not, but we're all planning as though it will because we much rather plan for the worst and hope for the best.
So that takes me into another question that I have that people are wondering. Once you get it and get over it, are you immune, and can you get it again? What are the chances of it?
We believe so. Now, with the caveat, because I don't want to be wrong tomorrow. The caveat is that has been our experience with most viruses. If you get this, your body develops antibodies, and it should protect you. Having said that, until we all start getting back together, and still we do more blood tests to prove it, we don't know for sure. We have this antibody test we're all depending on. We don't know for sure whether or not we're all as protected as we would like. Now, I just want to say that be upfront with folks, that we think it does. And so far, there's no really good evidence that people are catching it again. There's a couple stories of people that they're not sure about. If you look at the experience in other countries, they seem to be protected for some period of time. Whether it's a week, whether it's a year, whether it's 20 years, we just don't know.
What do you think about some of these holistic options or home remedies that people are trying, like something as simple as ginger or turmeric, or going in the sauna and kind of heating up your body, which has been said to get rid of viruses, and also more advanced things like high-dose vitamin C and ozone therapy?
Yeah, none of those things are efficacious. None of those have been shown to work. First of all, we've not had any kind of therapeutic trials to prove that they work. And the fact that someone says, I took this and I got better, that does not mean that it works at all. Anecdotes is not evidence. Hopefully people will study some of those things. I'm very concerned that people think that if you drink hot water, or if you take a hair dryer and you heat up your nares, that you're going to protect yourself. That is not the case. It is true this virus doesn't do well in warm weather, but that is not going to help you because it latches onto the mucous membranes in your nose and your respiratory package, and it won't let go.
Yeah.
So that won't help you. In fact, you're more likely to burn yourself.
Is there anything different that pregnant women that they should know? Anything that they should do that's different than anybody else?
Well, look, the early evidence is that there's not a lot of evidence that pregnant women are obviously impacted by this or their fetuses. Having said that, I don't trust anything that's not been real studied. I just think pregnant women ought to be more cautious because you're pregnant and because we don't know. There have been lots of pregnant women who've gotten this, we found out, who, by the way, didn't know they had it. They were asymptomatic. And so far, they seem to be doing reasonably well. And the babies that have been born so far have been shown to be reasonably okay.
How do we know that the information that we're getting about cases and death are accurate? Do you know how they're being verified?
No, I can tell you that all data is as good as the people that put the data in. Mm-hmm. And, things are pretty chaotic right now. So these are probably the best numbers that we got. They had this data sheet that people were supposed to fill out that had gender, race, and ethnicity, and they were having trouble getting people to fill the boxes out. So a lot of the data wasn't being captured. And then, of course, many of us had to argue in Yale for them to release the data on race and ethnicity because we were very much concerned that people of color and people in underserved communities were not being addressed. Understand that this is probably the best data that we have. Also that it will change over time. There will be more people that we're undercounting. Mm-hmm. We don't know what the denominator is. We don't know about all the well people. Well people meaning they didn't get the symptoms that were exposed to the disease. We also don't have a good count on all the people that have died. So those numbers will change.
I know that a lot of people are unsure because we're at home. I'm wondering, is it coming mostly from tests that are being done, or them just kind of ballparking from someone that is in the hospital and maybe counting their family members back at home?
It's a combination of the tests that are real numbers, that are positive, and people in the hospital, and people that go to the healthcare system that are reporting in to the public health departments or their insurance companies, and they're collecting data from all of those sources. We also know that there is some crowdsourcing data out there that correlates fairly well with some of these numbers. But the number of people who die today are real numbers.
I know that you gave a lot of tips, but is there anything that you want to leave the community with, how to handle this going forward and how to stay strong, but also very cautious?
We have a lot of tips about our physical health, but our mind is attached to our physical health.
Right.
And so I want people to spend some time thinking about themselves, thinking about their kids, hug their kids, check on their family members, check on their parents, and just not take this thing for granted. We can get this thing, and we just need to take this very seriously.
I really appreciate it. Thank you for the information, and thank you for your time today.
Amber, thank you. Listen, I appreciate you doing this. This is important for people like you to speak out because you have a following I don't.
I'm so appreciative of you taking your time in order to talk to us. Thank you again.
Oh, absolutely.
All right, take care.
You have a good day and be safe.
All right, you too. Thank you guys for watching. I wanted to ask him the questions that I keep seeing different information about, so I wanted to get some clarity on those things, and I hope that it did help you guys. Stay safe. See you soon.